have. So I'm like, let me make best use of my time and energy and go live on Instagram and YouTube. I'm going to be talking about some goodies that health organizations and professionals need to know about today. You need to know about these today. Okay. I also want to tell you about some exciting news that's happening over here at Jenkins Public Health Consulting today. Okay. All this stuff is for you to know right now today. First of all, where should I start? I want to shout out a brand that has really supported the health needs of my family. Literally not paid to do this, literally have put my own money towards this. I really believe in the brand. I believe in the person who's behind this brand. And we have known each other because we are both mothers and we are both business owners and we are both dedicated to the work that we're doing. And we prioritize quality ingredients and health, right, for ourselves and others. As you know, I'm a public health consultant. I'm the CEO at Jenkins Public Health Consulting. And so I focus on chronic disease and injury prevention. But this one is a skincare product, okay? My daughter has severe dairy and nut allergies. Everything we put in her mouth, in her body, it matters. If not, and we make a mistake, she can be hospitalized. It's that serious. I will talk more about allergies on this channel as well, because there is a lot of times that mistakes have happened that led to my daughter being admitted to the hospital, not admitted, but, you know, been to the ER a few times and ambulance at her school, more times than should be necessary, right? But anyways, I want to shout out this brand called Shira's Bottled Experience. She has formulated some beautiful products, skincare products for sensitive and non-sensitive skin. I bought some for me. I don't have sensitive skin, and I also bought some for my daughter that has very sensitive skin. But I wanted to show you mine, rub it on my skin, because this is really quality stuff, guys. And then I'm going to share with you the health-related resources that I want to talk to you guys about, and the award that I was selected for today. And they have me, they have it on social media platforms. But this is the lotion. It's not even a lotion, it's like a butter. Look at that. Oh my gosh, look at that. That's like, oh, cashmere butter whipped cozy cocoa cashmere. Thank her so much. This product is well formulated for perhaps all skin types, because she does have a non-fragrance product as well. But I do care about what I put in my body and on my body. I'm really big into skincare. This is all natural here. Hydration, food, everything is quality to my best, approach. But I just want to share some resources that are available for people that you should know about if you are working in public health, you're interested in pursuing a career in public health or healthcare. This is for you. Again, I'm Brittany Jenkins. I'm the CEO at Jenkins Public Health Consulting. We help health organizations strengthen their programs, their strategic partnerships, and relationships with community to improve access to resources and health outcomes. Chronic disease and injury prevention is really our specialty area. And we have helped pharmacies, health tech companies, hospitals, health departments, other nonprofit organizations strengthen their program delivery, just to make sure we're improving health outcomes and resources for community. It's really fun stuff. It might not sound fun to some people, but I love the work that I do, and I'm so grateful. It has a lot of flexibility. All of my clients are taken care of, while me and my husband and our daughter go to the farmer's market today and get some bread and some little things like that. God is good. But anyways, this upcoming training is sponsored by the Birmingham Public Library. We have partnered with them for 3 years now. I really love the public library. I actually go several times a week for the last several years because I think it's a great place for so many reasons. I take my family there. I go there to do extra work. I go there to network. It's been a blessing to my life, seriously. But I also have partnered with them to bring more resources to our community. And this opportunity is actually going to be available to people all over the world. Okay, it is completely free. And we are trying to communicate with stakeholders, staff, leadership of health-focused organizations and businesses on how to create sustainable health programs for under-resourced communities. Okay. And if you have an organization, or you're working for an organization, or you know of an organization, you're advocating for an initiative that you know they need more funding, they need more partnerships, they need more resources, they need to save some money, connect them with me. They need to be at this training because it's literally about how to create sustainable programs, not just one that is not developed yet, but how to strengthen your existing efforts. That's a lot of the work that I'm doing. I'm already working with a lot of companies who have existing programs, but they need to figure out how to strengthen and expand their existing program, right? And so we have a 5-step community impact framework that we use to help organizations work through this little process in 5 steps to expand their efforts, find more funding opportunities, new strategic partners. One of my clients, I helped them uncover and secure multiple 6 figures in revenue within 12 months, y'all. Okay, I'm proud of that. And so let me pull this up. I have my notes here. So this free training is happening April 9th at 12 p.m. Central Time. It's available to you no matter where you are in the world. Please join me. It's, again, you can go to www.jenkinsphc.com. Jenkins, Jenkins, phc.com, and you'll see the link to register for that training. Okay. During the free training, you'll learn why building community trust with intention takes more than a solution to their needs. A lot of the times, these health organizations, government, not government organizations, are going into communities and saying, hey, what do you need? We have the solution for you. And that's not the best approach. It puts up a barrier of trust. It makes people feel offended because you're just coming to me thinking I need you, or that I need help, or that I'm sick. And that's not the right approach, okay? So you'll be learning how to build trust with communities, how to strengthen your health programs, which means more than just funding and more staff, right? Because more funding doesn't actually fix the issues sometimes that most organizations have. I've been doing this work for over 15 years, working with organizations all over the country. Every organization is unique, is different, has different resource needs, but more funding does not mean less problems. Actually, it could lead to more problems because a lot of times organizations aren't using their funding appropriately, and it's leading to bigger issues that need to be addressed before they can actually optimize the money that they have and the staff that they have. It's a big thing, okay? You'll learn the reasons why strategic partnerships fall short and a better way to identify them. We have this 4 E's framework that has helped a coalition grow by 50% in less than 12 months. So we increase their membership and their engagement by 50% in less than 12 months using this 4 E's framework specifically for coalitions. And coalitions are a great way for any of you who's watching. I know there was a great amount of people in here watching to get involved, advocate for something that you're passionate about. If you love animals, if you are passionate about whatever in your life, about children, about health, find a coalition in your local area and volunteer, advocate, because there is real power in numbers. Really, whether you believe your vote matters or not, it does. I've worked in policy change for hospitals, for law, and it matters. And we need you, okay? The power phrase to remember when seeking to reach and engage your community on and offline, okay? That is huge. A power phrase to remember when trying to engage your community on and offline. A lot of health organizations fall short on their marketing. They do. I had a client, well, they're not my client, but I hope to make them my client. But they were telling me, hey, we spent $125,000 on marketing and it didn't work. And I was like, $125,000, you know what, you could buy a house. You can do so much with $125,000. They spent that on marketing and it was ineffective. And now they don't trust anyone and they don't know what to do. The visual design was beautiful, but the message didn't stick. And so that's what we talk about. We actually have a on-demand training that you can actually watch right now called Amplify, how to strengthen your marketing and community outreach for your health programs and initiatives. It's available right now. You can go to jenkinsphc.com, scroll down to the bottom. It's called Amplify, and you can watch that training. It's a 60-minute, I think it's a 90-minute masterclass. We collaborated with a health marketing organization. I'm your community outreach specialist. And we talked about some really great things. Some of the stuff that I'm kind of mentioning right now. So Amplify, you can watch that training on demand right now. The surge technique, you'll also learn about that if you attend this training on April 9th in collaboration with the public library. You'll learn the surge technique, SERGE technique, to remember that will transform the way that you do community outreach and engagement forever. I'm telling you, I've been doing this work. I actually started my company, Jenkins Public Health Consulting, in 2018 because I was working for a government agency that was serving my community back in Indiana. And I was a little offended by the approach. I was like, I think this is not gonna work. Thankfully, I worked for a team who trusted me, and I was the program lead for some of these initiatives. And we started to do things differently, and it showed. Right? That 50% increase in membership and engagement didn't happen because we were doing status quo things. It happened because we were collaborating with our community in a different way. Okay, it happened because we were changing the approach in which we talk to people and ask, hey, this is what we're doing. What are you doing? How can we collaborate? Versus just having a one-sided approach, right? Only focusing on us. It showed people how to have a multi-sector approach, right? Multiple individuals, organizations collaborating for the biggest impact. You can't do it alone, you know. And so this program, this training is completely free to you no matter where you are in the world. And you can go to Jenkins, JENKINS, PHC.com to learn more. Register today, and I'll see you April 9th. It's going to be great. Our trainings are not typical trainings. I actually had a really challenging environment that I had to train, and I made that assumption. It was oncologist, right? And I was like, oh man, oncologists are going to be hard to train. They're probably going to think this is boring. And they thought this was the most engaging training that they've ever experienced, right? Because we do more than just talking to you and then go about your day. We are really interactive from start to finish, and people appreciate that. And we give you homework. We give you action items to go implement right away so that you can be a better you for yourself, for your community, for the work that you're doing. And it really works. So join me April 9th. I would love to see you there. I also want to share that we do have a health equity guide. Sorry, I need to put my clip back in my hair. We have a 10 ways to advance health equity for your health programs and initiatives. It's a free download for you. When you download that, actually, you'll also be notified about this training, but you'll also stay in the know about what's happening at our company. We have some other programs and resources that are available to you as well. But that 10 ways to advance health equity includes AI prompts to evaluate your existing efforts. Now, I love AI. I think it's a great tool. But one thing about AI that doesn't work is when people are putting together prompts that have not been tested or that actually are not effective. These prompts actually work to evaluate your programs and initiatives because it's evidence-based, but it's also streamlined that you don't have to think about these prompts yourself when you're trying to evaluate your existing efforts, okay? So check out that health equity guide for advancing your health programs and initiatives. For achieving health equity in your programs and initiatives, okay? Another resource that I want to talk about is our public health mentor program. If you are someone who is just starting out in the industry of public health or healthcare, maybe you recently graduated, maybe you're still in college, you're in your last year, or you're on the other end of that spectrum. You have been working in public health. You're looking to make a career change. You're looking to make an increase in salary. You are like, hey, I'm burnt out in my current role. I want something new. Then we need to connect. No matter if you're entry level or experienced, let's connect. We have an 8-week accelerator that has helped men and women around the world land a job, a high quality, high paying job within 90 days. Okay, so you'll work with me for 8 weeks to build confidence and competitive skills, not the typical skills you learn in college, not the skills that you even really learn in the workforce, because they're not there. You will work with me privately, not one-on-one, but it is a group. And we'll show you exactly what you need to do to land high-paying, high-quality jobs in the industry and do it very fast. Most people who have went through that program have been able to land a job as a senior analyst, while I think they didn't have any paid experience, but they were in a fellow program. So they went from college graduate to working in a senior level position. One other person, they were working in public health for a few years. They wanted something new, and so they were able to land a senior level job for the American Hospital Association. We had people who were unemployed for 2 years, then they landed a job within 90 days as an epidemiologist. I mean, we have hundreds of testimonials. Okay, and so we want you to be a part of this initiative or accelerator, because it is literally the most effective accelerator on the market. We know our competitors, and a lot of the times you're just joining another group of hundreds of people who have the same problem, and they're getting inundated with information that you're just truly throwing spaghetti at the wall versus actually getting the result that you came to receive. So the Public Health Mentor Program is an 8-week accelerator just for you to get the results that you're looking for when it comes to landing a job in public health. Thank you guys so much for engaging with me. I know YouTube is a harsh crowd, but guess what? I'm here doing the work that the Lord has called me to do, and I appreciate you for the engagement because it actually helps my channel grow. So that's the Public Health Mentor Program, the 8-week accelerator. If you want to land a high quality, high paying job in 90 days or less, I'm your girl, Brittany Jenkins. I will help you do that. It will be me. All right. So thank you guys so much for engaging with me. I also wanted to let you guys know today is a very special day. First of all, today is my brother's birthday, and he means the world to me. And we were actually twins. We're not real twins, we're Irish twins, but we are technically twins. And his birthday is today, and it's just so exciting. We were the same age for 3 weeks. And also today is also special because I received an award from the city of Birmingham, Alabama, that recognized sheroes, women who are doing great things for their community. And it was all types of women who are doing great things that were recognized, who will be recognized. Today is just my day. They're recognizing one woman per day for the next 30 days, and today's my day. And they're saying these are for unsung heroes. A lot of times these recognitions are for Fortune 500 companies and women who are making $5 million a year and all these, astounding, awesome things, but not for the ones who are doing like the community-based great impact in their communities. And so I am so, so honored to be recognized for this award. I'll be standing alongside the mayor in a few weeks to just be recognized for the work that I'm doing in the city of Birmingham and beyond. Jenkins Public Health Consulting supports health-focused organizations and business across the United States, not just in Birmingham, Alabama, but we are doing great work in Birmingham, Alabama to address type 2 diabetes and also train community health workers. Among other things, we're working with a health tech company to build health clinics, things like that. So God is good, and I'm so, so proud to be recognized. And I also want to thank my husband. In the publication, it mentioned me and my daughter, but it did not mention my husband, who supported me. God, he supported me in the things that I'm doing on my business, through the highs and lows, through the good and bad. And, I'm just so grateful and so blessed. So if you are working in public health or healthcare and you're looking to connect with a public health practitioner, an award-winning CEO of a consulting firm, and also I'm a certified health education specialist, please connect with me. We have resources for your health organization, your coalition, your association, speaking, training, etc. Thank you guys so much for your time. You have a wonderful day.